hi. How are you doing today? Wonderful. Thank you so much for coming in. My name is Dr. Matt. I'm going to take care of you today. Great. Do you have an appointment? You don't? Okay, no problem. Let me just finish up some notes and then I'll find an appointment for you. Does that sound okay? Okay. Okay, wonderful. Can I please have your first and last name and your date of birth? Okay. So I do have a 4 o'clock appointment available. Would you be able to wait or no? Okay, gonna wait. Okay, so it's 4 o'clock and thank you so much for being here. Can you please tell me what is the problem? What's concerning you? Do you have any health problems? Okay. Okay. I see. So you're relatively healthy. Awesome. I love that in a patient. Okay. Are you experiencing any headaches, any double vision, any tingling sensations, numbness? No? Okay. Do you have any back problems? Not really. Okay. When was the last time you had a physical? Okay. So it's been a year. We can do that. Okay. Can you please tell me, did you have any serious injuries in the last month or so? Oh, you hit your head. Okay. Yeah, that doesn't sound good. Did you have any symptoms after that? Okay. Have you ever felt dizzy? No. Any blurry vision? Okay. What about changes in your facial sensation? Not really. Okay. So we can do a head-to-toe assessment. We can do an annual physical. We can do a cranial nerve exam. And I can also test your vision, your hearing, and your nose and your mouth. Does that sound okay? Okay, great. All right. So let's go ahead. We're going to have to ask you a few questions about your medical history since you're a new patient with us. Do you have any major illnesses, any major medical history that I should be aware of? I don't know, cardiovascular problems, urinary problems, respiratory problems? No? Okay. Awesome. And have you had any hospitalizations in the last 12 months? No. Okay, good. No hospitalizations, no injuries. Okay. Are you suffering from mood disorders, depression? No. Okay, great. Have you ever had a blood clot? No. Okay, hypertension or hyperlipidemia or diabetes? No. Okay. So no health concerns at the moment, but we do need to do an annual physical for you. Okay. Are you on any diet? No. Okay, so you eat everything, anything. Okay. And how often do you exercise? Per week? Okay. So 1 to 2 times, around 30 minutes, 30 minutes. Okay. Are you taking any medications right now? No? Okay. Okay, so we're going to test your vitamin D level and your vitamin B12 as well at the end of this session. Okay. And how many hours per night would you say that you sleep? Okay. Are you in a healthy relationship? Great. And who would you describe as your support person? Do you have anybody? Okay. Are you married? Okay. So let's go ahead and start with vital signs first. I'm going to put 2 fingers on each wrist, one over here and one over here. Good. And just relax. Okay. So your pulse is equal, symmetric, and 2+. So that's perfectly normal. And I would say you have about 75 beats per minute, which is awesome. Okay. Do you have any kind of chest pain, palpitations, or shortness of breath? No. Okay, wonderful. Now I'm going to measure your respiration, so I'm just going to need you to relax. Okay? Just try to breathe normal as best as possible. Good. Just breathe normal. Just breathe normal. Good. Just breathe normal. Okay? And I'm just trying to count How many respirations in 1 minute? Okay. How many respirations in 1 minute? Okay. Okay, just try not to focus on your breathing, and you can focus on my eyes, on my nose. Okay, good. Good. So your breathing is about 12 breaths per minute, which is absolutely normal. Now let's go ahead and take your temperature. It's going to be sublingual, so we're going to put the tip of the thermometer underneath your tongue. Is that okay? Great. Okay, so I'm just going to put this right here underneath the tongue. Okay, great. Just hold it in just like that. Good. Wonderful. Okay. Normal temperature 98.5. And now let's go ahead. We're going to take your oxygenation. Just going to put this on your finger. Okay, so just try to relax. Take a deep breath in. Sometimes that helps. Okay, just take one more deep breath in. Excellent. Okay, so this also measures your heart rate, and now it's about 73 beats per minute. So I was right, and your oxygenation is 99% on room air, which is wonderful. It just tells me that your lungs are breathing very strong. Okay. Let's go ahead and take your blood pressure. So do you have a preference on which arm to use? Not really. Okay, good. So I'm just going to put it on your left arm. Great. So just hold it in just like that. Okay. And we're going to inflate the cuff. Please make sure that both feet are on the ground. Good. And try to relax. Sometimes it helps if you close your eyes. Close your eyes. Close your eyes. Good. Okay. Love it. Your blood pressure is absolutely normal. 125/60. Excellent. I love it. Now I'm going to listen to your heart and your lungs. How does that sound? Okay. So you're saying that you don't have any kind of shortness of breath or chest pain, correct? Okay. Okay, so just relax. I'm going to put the stethoscope on your chest. Good. Just gonna move it a little bit lower. Perfect. Just one more time. Okay. Let's go ahead and change. We're going to listen with the bell now. Great. So everything sounds absolutely normal. I love it. Love it. Love it. Okay. Now let's go ahead and listen to your lungs. So this is just going to go on your chest in the middle right here. And take a deep breath in. And exhale. Good. Now I'm going to go ahead and change it. So just I'm going to put it right here. Take a deep breath in. Good. And exhale. Very good. One more time. Take a deep breath in. And exhale. Great. Now we're going to listen to the side. So to the side of your chest. Yes. So just take a deep breath in. And exhale. Great. And now I'm just going to move it to the right side. So just take a deep breath in. And exhale. Great. Okay, let's go ahead and listen to the back. So just please lean forward for me. Lean forward, lean forward, lean forward. forward. Okay. Lean forward. Lean forward. Good. Take a deep breath in now. Good. Okay, I'm going to listen to the other side now. So, same thing. Just lean forward and take a deep breath in. Good. Take a deep breath in. And exhale. Very good. Very good. Okay. Let's go ahead and write the results in your chart. Okay, so your blood pressure was 125/60, temperature 98.5, heart rate was 73, and respirations was about 12. Okay, so oriented time, person, and place. Okay. I couldn't hear any rhonchi, no dyspnea, no chest pain, no rales. Oxygenation is perfectly normal, and no easing. Lungs sound clear, no history of asthma, so you're not using any inhalers. Great. I was able to hear S1 and S2, no S3, no S4, and no heart valve problems. So that's great. So let's go ahead. We're going to test all 12 cranial nerves today. We're going to start with the first one, which is the olfactory nerve, and that is the sense of smell. I'm going to gently touch your nose. Can you please tell me if you're having any pain? No? What about now? No. Okay, what about now? Good. What about now? Okay, great. Now I'm going to obstruct one nair, and I'm going to ask you to breathe with the opposite. Does that sound okay? Okay, so just like that. Okay, let's see. Now breathe in, breathe out. Good. And now I'm going to do the same thing on the other side. So same thing. Breathe in, breathe out. Okay, so no obstruction, which means that when we're actually going to do the test, you'll be able to inhale very slowly and tell me what you're smelling. Okay, let's go ahead. So I'm gonna need you to cover one ear. Okay, just one. And can you please tell me what you're smelling? Good. Okay. Great. It smells like coffee. I know. Very good. Okay. I have one more. Now we're gonna go ahead and just, close the other ear. Okay. Go ahead. Okay. So I'm just gonna ask you to breathe in, breathe out, breathe in, breathe out. What does that smell like? Great. Lavender. Smells like lavender, lavender, lavender. Okay. So everything on the olfactory nerve is great. No abnormalities noted there. Now let's go ahead and check your optic nerve. So we're going to check the color, check reflexes, acuity, and all of that. Okay. So first, let's go ahead and check acuity. We're going to use a Snellen chart for that. Okay. So this is called a Snellen chart, and I'm going to randomly ask you to read some letters. Okay. Should we start? Perfect. Okay, so go ahead. Can you please tell me what letter this is? E. Good. What letter is this? Can you please read the last row? The last row. Okay, go ahead, read. LDFPH. Perfect. Okay, now let's go ahead and continue. What letter is this? Right here. Right here. about this one right underneath? What letter is this? D. Okay. What about this one right here? What letter is this? D. Great. What about this one? Letter L. Okay. So your vision is 20/20. That's really good. Next, we're going to check the fields. So we're going to divide your field of vision into 4 quadrants. Okay, and I'm gonna ask you to follow my fingers with your eyes only. Don't move your head at all. Does that sound okay? Okay, do you think you can do it? Okay, good. So just follow my fingers. Okay, good. 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 Perfect. Now please tell me which fingers are moving, right or left? Good. 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 Perfect. Very good. 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 Excellent. Good. 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 Perfect. Okay. Can you please tell me when you don't see my fingers in your field of vision anymore? This is going to be really easy. Perfect. Wonderful. Great. Very good. Okay. Now I'm going to divide your field of vision in half, and I'm going to ask you to tell me when you don't see my fingers in your field of vision anymore, okay? So this is half, okay? So now just tell me when you don't see my fingers. Now, good. Now, good. Now, good. Now, good. Same thing on the other side. Tell me when you don't see my fingers. Now, good. Now, good. Now, good. Now, good. Wonderful. Now I'm going to ask you to look up for me, and I'm going to flash a light in your eyes. So, okay. Now I'm going to divide your face one more time, so just look straight. Good. Look straight. Okay, perfect. Okay. I'm going to ask you to look right here at my finger. Okay. And I'm just going to check your eyes. Good. Now look right here at my fingers. Good. Same thing. Okay, perfect. Follow the light. Follow the light. Follow the light. Good. 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 Okay. Now look at my fingers and tell me when my fingers are moving. Now, good. Now look at the light. Perfect. Now please tell me which are moving, the light or my fingers. Fingers, good. Light, good. Fingers, good. Light, good. Light, good. Fingers, good. Both, great. Now we're going to perform what is called a fundoscopy. So I'm going to bring this light a little bit closer, and I'm going to take a look inside your eye. Is that okay? Okay. For this exercise, I'm going to need you to look a little bit behind me. So do you see this light right here? Okay. Just try to focus on that first. Okay. Focus on it as much as you can. Very good. Okay. Alright. So your optic disc is intact. No abnormalities noted. Everything looks very healthy. Okay. Now I'm going to go ahead and do that one more time. This time I'm going to ask you to take a deep breath in and pinch your nose. Can you do that? So breathe in and pinch your nose. This way we're going to create a pressure. So just look right here for me. Good. 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 Create a pressure, and it's gonna allow me to better visualize the optic disc. Okay, good. Okay. Very good. You can breathe now. Sorry, sometimes I forget to say that and my patients keep on not breathing, so that's not good. Okay. Next, we're going to check your trigeminal nerve. That's so exciting. So, the way we do that is by very slowly touching your eyeball with a string from here. And what I'm expecting for you to do is to close your eyes immediately. So I'm not going to force anything if that's the case, okay? But this tests your trigeminal nerve. Okay, so just keep your eyes closed. I'm gonna try to touch your eyeball. Good. Okay, so you did close your eyes. Now let's go ahead and check your other one, okay? Yeah, we did check only the right one, so we have to do both. Okay. How's that? Okay, so very good corneal reflexes, which means that your trigeminal nerve is intact. Now we're going to go ahead and check the motor supply of your face. So what I'm going to do is called a jaw jerk reflex, and I'm just going to slowly tap on your jaw, and I'm expecting for your jaw to move something like this. Does that sound okay? Okay, so just relax. I'm going to put 2 fingers right here on your jaw and just, okay, very good. Let's do that one more time. Okay, so very good jaw jerk reflexes. The motor supply seems to be intact. And we're going to check your maseter and temporalis muscles as well. Temporalis muscles are right here, and the maseter muscles are right here. So let's go ahead. We're going to begin with the temporalis. Good. Okay, everything looks perfect. And now I'm going to check the maseter. So I'm going to just put 2 fingers on your jaw on each side. Very good. Now I'm going to ask you to clench your jaw. Good. Just keep it clenched. And I'm going to try to move it side to side. Good. Okay. Very good. Okay, so let's see. No problem seems to be here. I just want to do a little bit more in detail. And what I need you to do is to clench your jaw. Good. And unclench. Good. Clench your jaw. Good. Clench. Okay. So everything looks very normal. Now we're going to go ahead and check your facial nerves. So we're going to start with facial sensation. So first we're going to touch with this cotton ball. And I'm going to need you to tell me if you feel it, okay? Let's go ahead and start with the right cheek. Do you feel that? Okay, great. Now let's go ahead on the left cheek. Do you feel that? Okay, wonderful. On your forehead. Great. And on your chin. Wonderful. And did you feel it equally on all sides of the face? Okay. Now I'm going to go ahead and do a little bit sharp, okay? So please tell me if you feel this. Do you feel it? Okay. What about this? Okay. Did you feel it equally on both sides? Great. Now on your chin. Good. And on your forehead. Okay. Great. Now I'm going to ask you to give me a big smile. Okay. Brown and puffy cheeks. Great. Now let's go ahead. I'm going to ask you to open your mouth and I'm going to take a look inside. Does that sound okay? Okay. So we're checking the uvula if it's midline. We're checking the tongue if it's also midline. And it doesn't seem to deviate to the right or the left. So that's very good, very healthy. Okay, let's see. Good. I'm going to ask you to move your tongue up and down for me. Good. And now side to side. Excellent. Okay. Everything seems to be normal. Good. Let's go ahead and check your vestibulocochlear nerve. We're going to use the tuning fork for this. And we're going to do what's called the Rine test. Okay, I'm going to create a vibration sound, and first I'm going to put it right here on your mastoid process, and then I'm going to put it right in front of your ear, and I'm gonna need you to tell me which one is louder. Okay, this one or this one. So you can refer to this as position number 1 and position number 2. So you can tell me position number 1 is louder or position number 2 is louder, whichever you think. Okay. Okay, ready? Okay. And what about this? Okay. So, position number 2 is louder. Perfect. Okay, I'm going to repeat that just on the other side. Okay. Good. And this is position number 2. So which one was louder? Number 1 or number 2? Number 2. Okay, perfect. Okay, so that was the Rine test. Now we're going to do the Weber test, which is kind of the same thing with the tuning fork. But now I'm just going to create the same vibration sound, and I'm going to put it one time here and then one time on the other side. And I'm going to need you to tell me if you hear right or left a little bit louder. Okay, maybe you hear them the same. So whatever you think, just tell me, and that would be the result. So this is one. Okay, good. Tell me when it stopped. Good. And now we're gonna put it on the other side. Okay. Just please tell me when it stops. Stopped. Good. Okay, so can you please tell me if you heard it the same on both sides or one was louder than the other? You heard it the same. Excellent. Okay, now we're going to go ahead and check your glossopharyngeal nerve, and we're going to check your gag reflex for that. Okay, because the glossopharyngeal nerve innervates the pharynx, so all this anatomic part right here. Okay, what I'm gonna have to do is I'm just going to place this wooden stick on your tongue, and I'm gonna try to touch the back of your throat. If it's too uncomfortable, then that's the test and everything is good. Okay, so I'm just gonna need you to open your mouth. Okay, and stick your tongue out and say ah. Okay, so that was the gag reflex that I was talking about, and that's absolutely normal. Okay, next we're going to check your accessory nerve, and most specifically your trapezius and your sternocleidomatoid muscles. Okay, so for this test I'm gonna put my hands on your shoulders, okay, and I'm gonna ask you to shrug your shoulders, and I'm going to push down at the same time, so just try to resist that. Okay, very good. Now I'm gonna ask you to look this way, and I'm just going to place one hand on your face and try to resist my pushing. Okay, just keep on looking, good. And now I'm going to do the same thing on the other side, so just look this way for me, look this way. Good. Okay, just keep on pushing, push. Okay, very good. Everything looks healthy. We're done with the cranial nerve exam, and we did do a head-to-toe assessment a little bit, like an annual physical. We did check your eyes as well. I couldn't find any abnormality, so that's very good. But if you do feel like you want another checkup, just let me know, and I can make another appointment for you. How does that sound? Great. Thank you so much for coming in. Have a good night.